sad and depressed? Maybe you feel anxious and full of worry. Perhaps you feel intense anxiety, or you have sudden feelings of panic. Well, if any of that rings true, then Effexor XR is the drug for you. Clinical trials have indicated that Effexor XR, or venlafaxine hydrochloride extended release capsules, were more effective than placebo treatment for people struggling with depression, generalized anxiety disorder, social anxiety disorder, and panic disorder, with or without agoraphobia.
But wait! Effexor XR should not be used to treat patients with a hypersensitivity to venlafaxine hydrochloride and should not be used alongside MAOI treatments. MAOI treatment should begin no sooner than 7 days after stopping Effexor XR due to increased risk of serotonin syndrome. You might be wondering, what are the dosages of this cute little pill? Well, Effexor XR is offered in the following dosages: 37.5, 75, and 150 milligrams. Each pill is labeled with Effexor XR along with the dosage amount with separate colors for each dose, as shown here. Effexor XR is taken once per day orally. It is suggested that patients start their treatment at 37.5 milligrams per day to allow an adjustment to the medication, followed by an increase to 75 milligrams per day after 4 to 7 days as needed. The average dose of Effexor XR is about 140 to 180 milligrams per day. There is a maximum recommended dosage, though, of 225 milligrams per day, with dose increases of up to 75 milligrams per day. But when you're taking the capsules, do not divide it. Do not crush it. Don't even chew it. And you better not think of placing those little capsules in any water. Each capsule should be swallowed whole with fluid or administered carefully by opening the capsule and sprinkling it on a spoonful of applesauce. Well, we only had yogurt in the fridge, so just use your imagination, people. Effexor XR can be administered with food in the morning or in the evening, but it should be taken around the same time once per day. Dosage adjustment based on the age or gender of a patient is generally not necessary, and a gradual reduction in dose rather than an abrupt cessation is recommended whenever possible. Venlafaxine and ODV undergo extensive metabolism in the liver. Research has shown that 92% of a single oral dose of venlafaxine is absorbed. The absolute bioavailability of venlafaxine is around 45%. Food and time administration do not affect the bioavailability of venlafaxine or ODV from the 75 milligram capsule. Effexor XR's half-life is 5 to 11 hours, give or take 2 hours, and reaches steady state concentrations of venlafaxine and ODV in plasma within 3 days of an oral dose therapy. Oh, and about 87% is excreted through the urine within 48 hours. Ooh.
So how do other drugs interact with Effexor XR, like cimetidine?
I'm so glad you asked. Well, the co-administration of cimetidine and Effexor XR shows a 60% increase of venlafaxine's maximum plasma concentration, or Cmax, but no change in the pharmacokinetics of ODV. The overall pharmacological activity of venlafaxine plus ODV is expected to increase slightly, but not enough to adjust the dosage for normal adults. Caution is advised, though, for patients with pre-existing hypertension or for elderly patients.
Okay, but what about diazepam and lithium?
You know, I'm so happy you asked that. The co-administration of diazepam and lithium respectively with Effexor XR show no notable effects in patients.
Okay, well, but what about haloperidol?
Wow, another great question. Venlafaxine showed a total oral dose clearance of haloperidol by 42%, which resulted in a 70% increase in haloperidol AUC. Also, haloperidol Cmax was increased by 88% as a result of the co-administration, but the half-life was unchanged.
What is the effect of the co-administration of Effexor XR and drugs that interface with hemostasis, like NSAIDs, aspirins, and warfarin?
Well, actually, NSAIDs, aspirin, and warfarin have been shown to increase the risk of bleeding.
Okay, Michelle, what about ketoconazole?
Well, Carlos, the co-administration of ketoconazole and Effexor XR have been shown to result in higher plasma concentrations of both venlafaxine and ODV.
What about the co-administration of imipramine and Effexor XR?
Well, imipramine didn't affect the pharmacokinetics of venlafaxine and ODV, but it showed elevated 2-OH disipramine levels in patients.
Okay, metoprolol. Tell me about that.
Well, the co-administration of metoprolol and Effexor XR showed an increase of plasma concentrations of metoprolol by 30 to 40%, but it didn't alter the pharmacokinetics of venlafaxine or ODV. Venlafaxine did reduce the blood pressure lowering effect of metoprolol, which should result in the cautious co-administration of these medications.
What about risperidone?
Well, the co-administration of risperidone with Effexor XR proved that venlafaxine slightly inhibited the metabolism of risperidone, resulting in a 32% increase in risperidone AUC.
Last one. Triptans. What is the effect of the co-administration of this medication with Effexor XR?
Well, there are some rare post-marketing reports of serotonin syndrome with the use of an SSRI and triptan, so caution is recommended. Oh, and just in case this applies to you, a false positive urine screening test for PCP and amphetamine have been reported in patients taking venlafaxine for several days following the discontinuation of venlafaxine therapy, so be careful. Some common symptoms of Effexor XR include unusual dreams, sexual problems, loss of appetite, constipation, diarrhea, nausea, vomiting, dry mouth, tiredness, fatigue, change in sleep habits, yawning, tremors, dizziness, blurred vision, sweating, feeling anxious or jittery, increased heart rate, headaches. Additional symptoms of Effexor XR include the following, but you can read it because I've done enough talking so far. Believe it or not, I'm not done. In addition to some of the previously stated symptoms, the abrupt cessation of treatment or change to another antidepressant may cause anorexia, electric shock-like sensations, confusion, and dysphoric mood. The frequency of these symptoms increase with increased dose level and with longer durations of treatment. Keep in mind that venlafaxine treatment during pregnancy should be used only if clearly needed due to adverse effects shown in studies with animals. Also, venlafaxine and OGV are excreted in human milk, so either nursing or medication treatment should be discontinued if applicable. So, based on all the information and research that I've personally read, although Effexor XR may cause side effects like hypertension and increased gastrointestinal issues, it is an effective treatment for severe depression, social anxiety disorder, and generalized anxiety disorder. In fact, one book I read stated that it even might be helpful in treating chronic pain. So keep Effexor XR in mind next time you see your healthcare professional, and maybe it'll be helpful for you. Goodbye, everybody. Bye-bye. This was a Michelle Gomez production with the help of Carlos, too. Yay!